Hello and welcome back to the channel. We've been joined once again by Dr Alison Mace for another dental demystifier, shall we say. That sounds like some kind of product that you have in the corner producing gas. But I want to say thank you to all the questions that you guys put on the previous video. It's provided us with some really interesting things to delve into. I say we, it's not myself that's had to do the vast majority of the work here. So, we're again relying on your dental expertise. So which things sort of particularly piqued your interest from people's questions?
Yeah, there was a really good range of questions that came through, and I'm really grateful to everyone who commented and gave such positive feedback on the last video. So there's kind of a few questions that really stood out as to things that people wanted to go through. So one of them was homemade toothpastes, and if there's actually a benefit to sacking off the ones you buy in the shop and making them yourself at home.
Now the question is, does she know what I've done in a previous life? Let's have a chat about what your view is on toothpaste first, and then maybe we'll see my side.
Okay, so homemade toothpaste, they've kind of been around, well, they were the original toothpaste before they started to get mass produced. But there's lots of recipes out there. Most of them have kind of 3 core ingredients. So sodium bicarbonate, or like a bentonite clay, a essential oil to make it taste nice, and then like coconut oil just to help kind of bring it all together. The
bicarbonate, that's essentially the scrubbing bit though, isn't it?
Yeah, essentially, yeah. So that's the main abrasive element, which is the thing that helps get the plaque off your teeth. So there's loads of different recipes to make it. There was a really good study that I found that was done in 2021.
Okay.
And it kind of looked at 84 different homemade toothpaste recipes.
I can't imagine that you can manage to make 84 different varieties of that.
I know, yeah, of the 3 ingredients essentially. But essentially they looked at that and they found that none of those toothpastes contained fluoride, which, as we know from the last video, is really beneficial to preventing tooth decay. And then only 20% of them contain some sort of foaming agent, which is really useful for actually getting some of that plaque off your teeth. So essentially what you're getting is a kind of a flat, abrasive toothpaste.
Almost like car polish, by the sounds of it.
Kind of, yeah, that has some essential oil in to make it taste nice. So the other issue with them is that in store-bought toothpastes, you know exactly what you're getting. Everything's been pre-mixed, measured out to the nth degree. And so you know that everything in it is going to have some sort of benefit. With the homemade ones, because it's you that's mixing it yourself at home, it might not be that way. So if the recipe says a heaped teaspoon, my heaped teaspoon might be different to your heaped teaspoon. So you might end up with loads and loads of bicarbonate, which is the abrasive ingredient, and then not enough of everything else. So then you end up scrubbing away more of that enamel of your teeth than you should do, which can cause you more issues than benefit. So generally, I'd err on the side of caution and recommend not to make your own toothpaste at home and to buy it from the shop.
If, for the sake of argument, somebody did, is there a fluoride supplement you can buy that you could put into your homemade?
That's a good question. I don't know.
Probably not, I imagine, because it's the kind of thing that I imagine that there's a bit of a safety element of getting a bulk.
Yeah, I'd be cautious with adding your own fluoride into things because, again, it can have kind of negative impacts if the concentration is too high. The concentration you get in store-bought toothpaste is completely safe for use and is unlikely to cause any kind of harmful effects, especially if your teeth are fully formed. But adding it in on your own...
It sounds a bit dangerous.
It's a bit risky, yeah.
It's a little bit like sort of making your own glow-in-the-dark clock. There's no problem with radiation until you're trying to buy it from the shop, and the police tend to get involved.
Yeah, so what did you do in a past life?
You're aware that I had a bit of an episode on an island?
Yes, yeah.
So out there we were using toothbrushes that washed up on the beach.
Oh gosh.
And we were mixing our own toothpaste, which was fire ash, a little bit of sand and some seawater.
Oof.
Hey, at least we didn't get any problems out there.
Yeah, I mean, if you're washed up on an island and the only thing you have is some washed up toothpaste and some ash, then go for it. But if you have Tesco's round the corner or any other supermarket, that's your better option.
Yeah, I think so. I wouldn't recommend tasting fire ash. No, just don't. Really, really salty.
So one of the reasons people might go on to making their own toothpaste at home is not because they've been washed up on a desert island, but because they're trying to be more environmentally friendly. And to that I kind of say, there are lots of environmentally friendly options out there now. So there's lots of refillable toothpastes, lots of kind of toothpaste brands created by dentists that are sustainable, which would be a better route to look down than making it yourself at home. And just a quick Google of it will find you a whole load of brands. The main thing is just making sure it's got fluoride in.
Apart from the plastic tube, is there a big environmental impact from toothpaste?
I don't think so massively. It is just that tube. But then you consider if you've been using poor quality toothpaste and then you've got tooth decay from it and you need a filling, there's also an environmental impact of that. So prevention helps kind of prevent that environmental burden too.
In terms of the environmental burden, just going slightly sideways, there was some research I saw years ago that when, in theatre we're using the dithermy, there's a theoretical risk to the surgeon with regard to cancers and things like that, because essentially it's volatile compounds being breathed in. Is there any risk to dentists with regard to grinding teeth and things like that?
So with teeth grinding, obviously we always wear a mask, things like that. Because a lot of it is, we saw with COVID, with the aerosol that's generated. So especially if we're using like the high-speed drill, which puts out water, that is a risk to the dentist if they're not wearing a mask, because you can breathe in that aerosol, which, as we all saw during COVID, that's got loads of nasties in it, which you don't want to breathe in if possible. The other interesting thing is dental technicians, when they're working with acrylics, if you breathe in the monomer, that can cause cancer as well.
Okay, that makes sense. So what else did you find, on the questions that people put forth that you really wanted to get stuck into? Because obviously you've done quite a bit of prep for today. Yeah,
so another really interesting one was about water flossers, and then if they're actually good or not. So they are good. There are studies to say that they're actually better than using normal floss. So if you've got kind of reduced manual dexterity, or if you don't really like normal floss, water flossers are a really good alternative to getting rid of that plaque between your teeth. So thumbs up to the water flossers.
So is there any problems, if for example you've got a filling or stuff like that, because, correct me if I'm wrong, but the white ones are chemically bonded, but the metal ones are friction bonded. Is there any risk with a water flosser there?
If it's a well done filling, you shouldn't be able to force it out with a water flosser. It would be kind of the same with floss. If it was loose anyway, then you could potentially flick it out. But if it's well done, it's not going to come out with a little jet of water. Fair enough. So I'm confusing my water pick with my car wash. Okay. Yeah. Yeah, so that's kind of it with the water flossers. Another thing that was raised is kind of, what should I do if my gums are bleeding? Which is something I hear really commonly, because I don't know about you, but if my first reaction without being a dentist was I brush my teeth and my gums bled, I probably wouldn't brush my teeth. I don't know what you'd do, but...
So my viewpoint is blood should be inside. If it's outside, I probably want to talk to somebody quickly.
Yeah. So if your gums are bleeding, it's a sign that they're inflamed. Like I said before, you've got that plaque that sits on the teeth, and that's all the bacteria that's there. In a similar way to if you get a cut and there's something stuck in it on your body, what can happen is when that plaque sits on your teeth, your body thinks, or your body knows it's something that's there that shouldn't be there, but it can't get rid of it. So it's a way to try and get rid of it. Same as if you had a cut and there's something stuck in it, it gets inflamed, and so then it's more likely to bleed. What you need to do at home is brush all that plaque away. So really brush your teeth, because the bleeding is a sign you've got something called gingivitis, which is kind of very early stage reversible gum disease. So if you're brushing your teeth properly, what you'll find is that brush the areas that are bleeding more, because that's obviously the areas that need it more. And then after about a week, if you've been brushing right, the bleeding should settle down.
Okay, that fast.
Yeah, if it's not settled down, then see your dentist, because it may be that you've got slightly worse gum disease, which we call periodontitis, which is kind of a more serious condition and can lead to tooth loss if it's not treated.
Okay, makes sense. Now that actually gives me another thought. This is one of the things with doctors. We are specialists in our particular area. So, for example, I don't know a huge amount about neurosurgery because I'm just a GP. And thus, if I have a think about neurosurgery, I could be very wrong. I don't know anything about dentistry. So connecting the two bits you just said, well, if someone's got Gingivitis? Gingivitis?
Gingivitis.
Why not put mouthwash in your water pick?
Yeah, you absolutely could do.
You could blast it off with that, could you?
Yeah, you absolutely could do put mouthwash in your water pick. What the mouthwash that's particularly good for that is Dill or any kind of chlorhexidine-based mouthwash. And then you can put it between your teeth, which can get to the areas that you can't brush. So it's a really good idea to put that in there. The only issue with chlorhexidine as an ingredient is it can cause staining of your teeth sometimes. So just being cautious with that. But
now, in terms of staining of the teeth, is that staining of the teeth like coffee, where we can adjust it, or is it staining of the teeth like doxycycline, where bad luck to you if you're stuck with that?
It's very much more like the coffee side of things. Okay. So if you see your dentist, which you probably should be doing anyway if your gums are bleeding, they can easily clean that off. That's not an issue. Yeah.
So something that was asked previously, and actually I think is quite important, we consume significant quantities of fizzy stuff in our house, to the degree that we've gone and got a soda stream thing. Is it that the carbon dioxide making it fizzy is the bad for my teeth, or is it the orange flavoured syrup that we're sticking in to sort of make faux Fanta and things like that causes the problem? Yeah,
so it's a little bit of both, to be honest. Unfortunately, yeah. So we'll start with kind of the syrups, and then we'll move on to the CO2 that's added in. So with the syrups, again, they're kind of sugar-based. So every time you drink that fizzy drink, you're adding kind of that sugar into your mouth. And as we kind of said last time, the frequency that you're kind of consuming sugary things with is what really adds to the burden of tooth decay. Because if you're constantly sipping on things, you're constantly feeding the bacteria that sits on your mouth and that plaque. And they're constantly producing the acids, they're constantly eating away at your teeth. So it's kind of like if you keep feeding them, they're going to keep producing the thing that eats away at your teeth.
To be fair, I mean, it's perhaps just a little bit too personal for a second, but I recently went on a hot chocolate binge. I was stressed, all right? Sue me. But I was very aware of the change in my teeth during the days where I was having a lunchtime hot chocolate as opposed to just having lunch as well. And it's actually something I've stopped doing because I didn't like the feeling of it.
Yeah, so having it with your lunch is actually the best thing to do. If you do want to kind of drink a lot of fizzy drinks or any kind of sugary drinks, having them with a meal is the best thing to do, because then you're already getting that kind of, I don't want to say insult from the food, but the hit from the food, yeah. So if you want to have a sugary drink, have it with a meal. It's when you're sipping on it constantly between the meals that it's the issue. So hot chocolate with lunch sounds great.
Yeah, I think there was more hot chocolate and less lunch. I think that was the problem.
Fair enough. Yeah, then moving on to the second bit of things with the CO2. So you might think, okay, I'll go for the sugar-free syrups and just have the fizzy bit. Again, that can cause some issues in terms of the actual acidity of the carbon dioxide that you add in. So again, if you're sipping on it constantly, that acidity from the fizzy drink will wear away at that enamel, and then that will end up reducing that amount of enamel that's there, and then increasing your risk of things like sensitivity. And once the enamel's gone, you can't put it back.
That was going to be my follow-up question. I said with hope, but okay, fair enough. So this is essentially sort of going back to that thing you do at secondary school where you put a penny in the Coke and just leave it and it sort of slowly dissolves over time, isn't it? I thought it was more to do with the syrup in it, but yeah, it makes sense that the CO2 side of it's going to have that effect as well.
Yeah, so yeah, unfortunately, yeah, with a meal, great, but if you're sipping on it throughout the day, maybe rethink.
Okay, go on then. So in terms of meals and things like that, is there one particular food type that you think, from either a texture perspective, is rubbing the enamel, or a pH perspective, or a sugar thing? It's like, this is the worst thing you can think of to eat.
There's nothing that I can think of as particularly the worst thing, but things that have bad characteristics are really sticky things. So things that will stay stuck on your teeth, kind of keep producing that sugar. So things like sticky caramels that will just coat your teeth and then they get stuck in all of the cracks. You can't really get rid of it all. Yeah, they're not great.
Yeah, to be fair, I don't, as I say, that whole sticky sensation doesn't go down too well anyway. So at least I'm not at risk of that one.
Yeah, but if you want to kind of help things out after a meal as well, or if you're looking to kind of chew on something throughout the day that's not harmful. Chewing gum is a really good alternative.
So sometimes you see that they advertise chewing gum with sort of teeth whitening and sparkle dust and all the rest of it. Is that just PR, or do you think there's any benefit to it?
I can't say about the whitening ones because I haven't looked too much into it, but the actual theory behind the chewing gum is that it stimulates saliva flow, and because of the motion of just chewing something will stimulate that, and that will help remove some plaque from your teeth because saliva helps neutralise things and it helps with kind of the mechanical removal of plaque. So long as you're eating a sugar-free chewing gum, that's absolutely fine.
Does anybody still make a sugared chewing gum?
There are a couple, like,
Really?
yeah.
I mean, that sounds just so daft. He says thinking about the bag of Haribo he's got in his car. So, you know, why am I opposed to sugar in this but not sugary food? I don't know, but it just seems a strange one.
Yeah, chewing gum is pretty good.
Okay.
Yeah.
I'll have to go pick up some to wash away the Haribo afterwards. Other sweets are available.
Yeah, and then the last point the last question that was asked was about the link between mental health and oral health, which I think is a really good thing to go into, but it will come with a little bit of a trigger warning, just in case anyone does kind of want to skip past this bit. Be covering things like eating disorders, things like that. So a really interesting piece of research that I found was people with severe mental health issues are about 3 times more likely to lose all their teeth compared to someone without mental health issues. There's kind of 2 factors that play into causing that. So the first one being things that we as doctors do, being the medications, in that a lot of the medications have the side effect of dry mouth. Oh. And then because you don't have that saliva, you can't then wash away a lot of the plaque that's on there, and you can't neutralise things as well.
I'd honestly never thought about that. I mean, obviously when a patient talks to me, for example, if they're using amitriptyline, dry mouth's quite common, and I say, you know, oh dear, and try and look at alternative medications, things that don't have it. But I'd always considered dry mouth to be an unpleasant side effect rather than a harmful side effect. That's a real learning point for me today.
Yeah, so dry mouth, it doesn't just happen from medication side effects, it can happen from loads of different causes, I'm sure you know. But it can be really not harmful, but it can be really unpleasant for people because your saliva helps you with talking and it helps you with swallowing things, and to wake up in the morning with like a desert dry mouth is awful. And if you think about on your hot chocolate binge, when you had that kind of horrible feeling on your teeth, it's much, much worse for someone with dry mouth because you've constantly you can't clear away a lot of the plaque that's there. So you get that fuzzy feeling kind of instantly and you can't clear it away. Things you can do to help with the dry mouth, kind of frequent sips of water. Again, that comes back to the fizzy drinks thing. Make sure it is just water. Don't be sipping on squash because then that'll increase your risk of decay. Chewing gum, again, really helpful so long as it's sugar-free. And you can get some saliva substitutes, but they come with mixed reviews. And the other thing that kind of leads to the increased kind of risk of losing your teeth is more of the social side of things that come with mental health problems. So I know a lot of people, when their mental health is getting bad, the first thing that goes is brushing their teeth, because if you're out of whack, you don't have time to do, or you don't have the motivation.
I think that's the point there. You said motivation, and that's why sometimes when we've got severe mental health problems, or even mild mental health things, it's just if you've so I've had it described to me as the teaspoon approach. If you've only got 5 teaspoons in your jar to give out today, what are you going to pass? And actually, hygiene, teeth and things are very easy ones. Not to let slip, but to say, I don't have the energy for that today.
Yeah, absolutely. And I think that's really important to kind of acknowledge, especially as dentists as well, that it's not, as much as we'd like it to be everyone's priority, it's not going to be. And realistically, if someone doesn't have the motivation to brush for 2 minutes a day, it's about finding kind of alternatives that maybe need less spoons.
I was literally going to ask that. So I'm having a bad mental health flare, I can't get out of bed all weekend. What is the minimum that I can get away with to protect my teeth?
Yeah, so mouthwash is really good for that. Going back to the last video, kind of the chlorhexidine ones are the better ones, so like Dill, things like that. They are better for reducing kind of that burden on your teeth. They won't remove the plaque that's there, but they can stop it getting worse. Also, if you don't have the motivation to brush your teeth for 2 minutes, even just a quick pass round with a toothbrush is better than nothing. It's doing something a little bit is better than not doing it at all. And then again, chewing gum. If you really don't have the motivation to get out of bed, keep some sugar-free, mint-flavoured gum next to your bed, and at least that'll help freshen things up a little bit as well.
Okay, that makes sense. Because that's one of the reasons why I work so hard with the mental health patients that we have, because it's not just a case of I'm feeling low or down. It has this overarching impact on the entirety of your life. And from my perspective, my teeth aren't actually, I say aren't actually, my teeth are actually very bad, but that's to do with childhood issues. You know, I know how, what's the phrase I'm looking for? Self-conscious I am about my own teeth and how they look and things like that. And I can see very clearly how a mental health insult leading to you not looking after your teeth, leading to an intervention by a dentist, would then result in actually worsening of the mental health. So, you know, it's, if I could pay somebody to take out all the metal stuff without it causing additional damage, I would do in a heartbeat. But I know that doing that would still damage the remaining healthy teeth. So I have, you know, keep things as they are. And that makes a lot of sense.
Yeah, I think with kind of the mental health side as well, is that your teeth can have such an impact on your quality of life, and that if you're recovering from a severe bout of a mental health issue, and then you know afterwards that your teeth aren't great, it can really kind of play into your self-esteem and really make you struggle with things. So it's about kind of trying your best to prevent that happening, but also I completely understand that it's not necessarily something you have any control over.
Well, I presume it's also an additional hurdle to going to seeing a dentist. I imagine that somebody coming to see me as a doctor, a lot of it can be done at arm's length, or even if I'm listening to your chest, it's relatively non-invasive. But to have somebody going and poking around in your mouth, you know, is just about as invasive as you can get without being a gastroenterologist. You know, it's so very in there.
Yeah, it is kind of one of the most personal things that you can have done, because yeah, like you say, when you have any other bit of your body examined, you can kind of distance yourself a little bit. But as dentists, we have to look inside your mouth to be able to diagnose things. So it's, if you're anxious anyway, it can add a whole other layer of it, and especially with dental anxiety, it's a really huge thing, and it can be a real barrier to people accessing dentists.
Now, I'm really, really lucky with my NHS dentist. He's known me for a couple of years now, and we have a good enough relationship that I'm happy for him to poke a little bit of fun at me. But he will make a comment about that dental anxiety. I grip the sides of the chair the minute I lie down. You know, I am rigid whilst I'm in there, and don't think there's many things that properly unsettle me. I am not the best person to be around just before I go into the dentist.
Yeah, that's fair enough.
But you know, he cares for me fantastically, and you know, I would champion him until the cows come home. It's just getting over that hurdle every time.
Yeah, I think that's the same with a lot of people, is that it's not a hugely pleasant thing to have done, is going to see the dentist. One thing that I find does help some people is bringing headphones with them, because then you can try and close your eyes and listen to your music and let them get on with their job, and then they'll tap you when they're done. Interesting.
I might suggest that because, again, we've had a couple of patients that are very anxious. And sometimes it's bizarre how, as a GP, I get involved in the dental side of things. Like, there's a dentist very close to us, and some patients, it's like, fine, they'll come in, we'll give them the diazepam so then they can go around to the dentist and things. And it's, you know, it's shocking how we don't actually bother about our teeth until they're bothering us. And then they seem to have this massive ability to weigh on our lives.
Yeah, absolutely. They're the type of thing that a lot of people would rather forget about until they get an issue, but then the issues can be so awful in the sense of toothache is so all-consuming, you just want it gone.
But I imagine that must make some parts of your job very, very satisfying, because you can, if push comes to shove, you can take the tooth and remove that pain. You know, if somebody's having difficulty eating and stuff, you can give them back that joy of food by, you know, dentures and things like that. So it must be quite fulfilling at times.
Yeah, absolutely. I did find some of the most kind of fulfilling patients I saw when I was in general practice were the toothache ones who'd come in pain, and then in the space of 20 minutes, you can fix their pain, and suddenly their quality of life is so much better. And just being able to have the skills to do that is a really special thing.
That makes sense, that makes sense.
Yeah, I think that's kind of come to the end of the list of the questions that people have asked.
Well, I think that's probably a relatively upbeat, positive point to end it on. You know, not only seeing the benefits that, you know, our dentists bring to us, but actually the care, not the worry, but the care that we can actually get from our dentists. So to that end, what's the minimum that we should be seeing our dentist?
It kind of depends for everyone. Your dentist will be able to kind of tell you if you should be going every 3 months, every 6 months, or every 2 years. It's kind of all dependent on what your risk of getting decay and gum disease is. But every 6 months is kind of the standard. I mean, your dentist might say, no, you're doing really well, 2 years, or we need to see you a little bit more often, every 3 months.
Perfect. Okay. Because certainly in some of the areas I work, we've got quite a transient population. So people obviously will sometimes not have that regular dentist. So at least I'll be able to tell them that, you know, aim for the 6 months, trying to get registered in places.
Yeah.
Well, thank you so much for coming in. Genuinely, I find it really interesting. I learn a lot from these conversations. So I hope you guys at home have benefited as well. Please put some more questions in the comments so that we can run another sort of dental myths debusted, and we can see what more light we can bring to this sometimes scary subject.
Yeah, absolutely, yeah. Any comments or any questions, feel free to write them, and I'll try my best to answer them in the next video. And yeah,
Fantastic.
thank you very much for having me again.
We'll see you in the next one. Cheerio.